In the United States, our aging population continues to grow at a fast rate. The good news is that we can take steps now to support good health as we age. An internist associated with Wilton Primary Care and Specialty Care will join me on Health Talk today to provide important advice on healthy aging. So don't miss today's Health Talk. We're up next. Hello, I'm Dr. Eric Mazer. Today our topic is healthy aging, very personally important. Joining me is Dr. Jasmina Krstic, an internist with Wilton Primary and Specialty Care. Thanks so much for joining us.
Oh, thanks for
Jasmina,
having me.
It's great to have you on the show, first time.
Thank you, happy to be here.
And healthy aging, we're all interested in that. I think I get more interested in that as I age more. And there's certainly, aging is inevitable, but healthy aging is something that we have lots of control over.
Yes.
So tell us a little, what do you tell your patients about how to age
so
and be
many,
healthy?
You know, so many things that we can really prevent and help to really do many things that improve our health and improve our longevity. So some things we can't control. So we can't control our genes that we inherited. But you know, you can change some habits that can, you know, maybe give you that some difficulties and severe chronic disease and injuries throughout the life. So if you do simple steps like having healthy diet and regular exercise, and you go for regular checkups with your doctor, so many things can be really prevented.
Right, I think that we almost take it for granted because it's too easy, or if you shouldn't say it's easy, because it's not easy to do, but it seems so simple. But a healthy diet, maintaining your weight, exercise, don't smoke, don't drink alcohol to excess. I mean, if everybody did that, we'd all live 10 years longer or something.
Yes.
But why is it so, why are these such problems for us?
I mean,
as I say here, sitting myself substantially overweight and knowing that I should eat more healthily.
It seems easy. I mean, when you think about, you know, let's eat healthy, but you have different cravings. You have maybe a stressful day at work and you just wanna, you know, buy that Haagen-Dazs and sit next to your TV screen and just enjoy your life. But, you know, if we're motivated, if we think that just with doing a couple of steps, like following 5 simple steps, never smoking, never, like drinking in moderation, I wouldn't say never drinking, having Mediterranean diet, and exercising at least 30 minutes a day, you can really prolong your life for 10 years. So many studies were done, and you know, it's kind of those simple steps, which I know it's not that simple, but we can all do it.
They're simple on paper. They're not exotic drugs.
It's not exactly simple.
It doesn't take. You don't have to be a rocket scientist or brilliant. These are things that we all could do. Maybe we could take them one at a time. Not smoking. I mean, that's just pretty simple. Don't smoke.
Yes.
Don't smoke at all.
Don't smoke at all. Just don't smoke at all. Not like 1 cigarette a day. Not like 5 a week. Just don't smoke.
There's some changes in our society too, with vaping, which is a lot in the news, and the use of recreational use of marijuana. What do you say to people about that? Is this sort of the future smoking? Is this what should people really be doing with all of that?
They shouldn't be doing it. It's not healthy. It can really have major consequences to the health, and we don't know much. But you know, every day we are learning new things, and it seems it's really not gonna help, and it's gonna just increase mortality risk.
Yeah, and I think your point that we don't know, we certainly are learning about these. Back in the 1950s, which you can look up on the internet and see advertisements for smoking where it says doctors prefer Camels, which were the unfiltered cigarettes and couldn't be worse for you.
No,
and it really wasn't until the 60s and the Surgeon General's report where anybody ever said don't smoke. And women used to Movies used to glamorize it. Women thought it was glamorous to smoke.
But
it was cool to smoke.
Because we didn't know back then. Like now, we do know. That's the same with vaping.
So I think vaping and recreational use of marijuana. We need a lot of evidence.
Yes,
if you're going to do it, just recognize there's no data, and it could be quite harmful to you.
Yes.
And I know marijuana smoke has its own set of chemicals that are complex.
True.
So don't smoke. It's a simple instruction. A lot of people don't do it, but don't smoke.
And if you do, just try to do something. We have so many different steps that we can, your doctor can help you with nicotine patch, with support, just talking with a doctor, and we do have some medications that we can, prescribe
so you can
patients.
Stop if
you can stop, but you need to decide to stop.
I know the medicines, and I've read this. Really, unless you have a motivated patient,
nothing is gonna. No, it's not.
So you
have to decide. It has to be you. It has to be coming from you.
The problem is teenagers think they're going to live forever, and it seems like when the younger you are, the less concerned you are about your long-term health, and yet you can do so much damage to yourself as a teenager. I know, for example, melanoma. The fatal kind of skin cancer is related to the number of blistering sun rashes you have during adolescence.
Yes, that's true. So, but then parents should be involved, right?
Yeah.
Because, kids, they don't know.
And how about exercise? I think everybody thinks that exercise means you have to go to the gym with all of the beautiful people and get sweated up and be embarrassed. But that's not really...
You may. That's an option, of course. You may, and there are different exercises that you can do. Of course, cardio is really important. But any kind of activities is, beneficial. Just be active. You don't really need to go to gym if you don't want to go to gym. You can dance, you can play tennis, you can walk, just walk. We all, we're forgetting to walk. Hiking is so important. So many evidence of, Tai Chi, like in older population. It can improve balance, it can decrease fall risk, it can boost your immunity, decrease stress hormones, so your blood pressure can be better controlled.
And this is using that martial art not so that you become able to beat somebody in it, but it's really as an exercise and a balance.
If you need to beat somebody, but no, I mean,
I've seen suggestions. You don't have to park your car right in front of the supermarket. Park it in a distant space. I know for myself, and I do this, is if it's 2 flights of stairs, walk up the stairs. Don't take the elevator.
I agree.
You just have to consciously say, I'm going to walk the stairs, and just do it. And actually, you'll find that you get a little bit better shape. Walking is a great exercise.
Yes, and we have all bad habits that we need to work on. Like, we're taking elevator, or we're driving to the supermarket, which is like just a couple of, feet away. I mean, just walk, take a stroll, go hike. Play some sports, enjoy.
Swimming is good for a lot.
Swimming is perfect.
If you start to get old like me, I think in terms of your joints and your back, swimming can be a great exercise.
And recommendation, I just want to mention, is like 30 minutes a day. Any kind of exercise is, like I said, better than nothing. It can really prolong your life, you know.
And it changes, I know, your metabolism, affects how insulin interacts with your...
Not only that, the exercise is the most kind of transformative way that you can do for your brain, because it can boost neurotransmitters, it can boost your mood. Even just one single exercise.
I'll even add to that. I know there is preliminary evidence, and it is not definitive, that if you exercise, your risk of dementia goes down.
That's
Alzheimer's
also,
and there aren't too many things we can do to prevent Alzheimer's, but we know that may be one.
That can be one. Reading is the second thing. There's some evidence, preliminary also, that vitamin D can help, with that. Some food like to boost your memory, like folate, omega-3 fatty acid, having some good dark chocolate.
Yes.
In moderation, of course. Having the fish like salmon, it's really good, and it can improve your.
And that's a good segue, because you also mentioned Mediterranean diet.
Yes.
And we all hear about this. Tell everybody at home, what is that, and how do we transition to that?
So it's like, again, simple thing. You just need to increase your vegetables, your veggies, fruits, fish, and good fats, like olive oil and nuts. It has really a good benefit to prevent heart disease, and your risk of dementia should go down with that kind of food, and to improve longevity. And we know that in US we have some different metrics, and in US we have a shorter lifespan comparing to Spain, for example, or Japan or Norway, and they eat Mediterranean food, most of them. Norway and Spain, of course.
Much more fish-based diet.
Much more fish and veggies based. Don't eat red meat. Don't eat fried food if you don't have to. You know, like I said, we all have cravings, and
I know that this is a topical issue. Red meat is in the news now. There was just a major publication suggesting that red meat isn't as bad as we once thought. What do you feel about that as a physician?
I don't really agree with that. I think, I mean, again, we need more evidence, but I think red meat, like we all, you know, everything should be done in moderation. But if you have to choose in between fish and red meat, I would always go for fish. Yes.
And just calories in and of themselves.
Yes, we need to downsize our portions, you know.
So supersizing is not the
supersizing is not good. So any reducing, any calorie reducing, it has really benefits. It can significantly reduce oxidative stress that you do to your body if you're eating too much. So just, you know, thinking about how much.
And restaurants have increased their portion sizes over time.
I know.
And I know I've certainly been to some restaurants where they don't expect you to be able to finish the dinner.
They don't, because it's huge.
It's just huge.
But you can
I've been
take
able to
mini
finish
portion.
those dinners, but I think most don't.
You can always take like mini.
I've heard somebody say, and I thought this was helpful to me at times, is always leave something on your plate. Just get out of the habit of trying to clean your plate.
80% they're saying just don't eat everything.
So we're running out of time. We've only got a couple minutes left, but screening is also important. There are diseases we could essentially prevent if everybody got screened. Do you want to talk about that?
Of course. So it's really important to have regular annual checkup with your doctor, and at that visit, what usually is done, like vitals are checked. So you've been checked for your blood pressure and heart rate, and your weight should be in you know, normal range. We do check for diabetes and
these are things that are, you know, pre-diabetes, blood pressure,
cholesterol, high cholesterol.
These are things you don't have symptoms of.
You don't. It's like silent killer. You don't know until you really get checked.
And they're very treatable.
They are.
They're very, very
and
treatable.
not only that, like colonoscopy.
I was going to say cancer screening. We've got a couple minutes.
Cancer. So colonoscopy, mammograms, skin cancer screening, going for prostate exam and checking PSA, like blood test for prostate cancer, pelvic exam.
You know, everybody's, myself included as an oncologist, everybody's afraid of cancer.
True.
It's a terrifying disease. And there are certain cancers we really can't do a lot, pancreatic cancer, kidney cancer, et cetera. But there are many cancers that we can prevent if we do proper screening. So why not take control of your life and prevent colon cancer? What is that, the #1 killer of men and women combined?
Yes.
Or it's third, but it's up there, and we could almost prevent it in everyone if they're properly screened.
So easy to be screened for it, and there is no reason not to do it, because everything, almost everything, can be, like, you know, can be cured.
And if you catch it early enough.
Yes, yes.
And with colon cancer, you know, I've just been through it myself, the colonoscopy. Okay. And you know, it really, the colonoscopy itself, you're asleep for, and the preparation is 12 hours of your life. It's certainly worth it.
It is.
To prevent a terrible disease.
True. It's not that complicated. Like, it's one day of your life, right? And you can really improve, again, longevity and just catch something, that if something is happening, and get treated for. And
we've got only a few seconds left.
Sure.
Any final advice for people to age healthily?
I mean, just take these simple, I know it's not simple, but just take these couple of steps. Healthy diet, regular exercise, go to your doctor, regular checkups.
And don't smoke.
Don't smoke.
Don't
yes.
smoke. It's like poison.
Don't smoke. Yes.
And it's easy for me to say, but unfortunately we have run out of time. I want to thank our guest today, Dr. Jasmina Krstic. I'm getting it right, Krstic, for joining us on Health Talk today. Remember to share your questions and comments with us by calling Community Relations at Nuvance Health. That's 203-852-2250. I'll see you next time.
Well, Thomas, you've got pre-diabetes, but with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have pre-diabetes. Big time.
When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke, F-A-S-T, fast.
What can you do to get the most out of a visit with your physician? Who better to tell us than an internal medicine physician herself? I'm delighted to have Dr. Jasmina Krstic join me today to discuss how we can do our part in having a satisfying and productive doctor's visit. So stay tuned for Health Talk. We're up next. Hello, I'm Dr. Eric Mazer. Today our topic is getting the most out of your doctor's visit. Joining me is Dr. Jasmina Krstic. She's an internist with Wilton Primary and Specialty Care. Thank you for joining us, and again, welcome to the community.
Thank you. Pleasure is all mine.
Now, I think patients go to the doctor and they obviously go with a problem, but I think patients don't know how to get what they want out of that visit very often. They'll sometimes come in with long lists. What do you tell your patients about making that visit productive and constructive?
Yeah, it happens all the time. So yes, what is important is to get organized before you come. So we all have so many questions before coming to see a doctor, but then when you come, you kind of forget everything and there is nothing that you remember to ask. So I think it's important to write those questions down. You know, get organized, list your symptoms, bring your friend. So they can, maybe take notes and listen what your doctor is saying.
I've seen tremendous statistics about when a doctor has a conversation with a patient that they'll remember 20 or 30% of what they were told.
Yes, that's true.
Because you're so emotional at that time.
You can be overwhelmed. You can be rushed sometimes because we're all so busy, unfortunately. So it's important to plan ahead of time. And we have different kind of visits. if you're coming for a follow-up on some chronic issues, you know, you really need to stay focused and ask the most concerning questions. And if you don't, you know, you need to ask. There is no kind of silly question or, you know, dumb question. Just ask. If you don't understand, just ask again. And we can always give like written instructions. We can explain better. So you really need, it's your health. Right. You really need to understand, and you really need to speak up. Don't be shy. Speak up. And you know, but it's important not to bring a list of 30 questions because it's not good for you. First, you're not gonna remember all the recommendations. Second, doctor cannot be focused, and we can like kind of lose it, like what is the most important. So
really asking patients to think about
plan ahead.
It's not the time to try to get every ache and pain and twinge fixed. It really is a time to focus on the main issues of your health.
True.
So if there's a symptom that's bothering you a lot, you want to mention that one. If you get an occasional headache once a month, that may not be something that you necessarily need to discuss at that visit because everybody's time constrained and you want to focus on what's important to the patient.
Yes, that's important.
You want to say something about medications because that's always...
Oh yes, definitely. The best thing is really to bring a list of medications or bottles because, you know, you maybe you don't remember the name, the dose, or maybe you're a completely new patient, so we don't really know.
Right,
and you
telling us that you take a blue pill for blood pressure.
It's always blue, yeah.
doesn't help us as physicians.
And it's not safe, you know. If we don't know what you're taking, errors can be made, and that's a problem.
The other one I'd point is be honest. I think sometimes, especially with drug prices being so high, patients may take less medicine that's prescribed. They may not take a medicine. If you don't tell the doctor that, they may end up prescribing additional medicines.
Yes, or increasing the dose, and that's not safe again. So you need to be honest. You need to bring your pills, and we need to know those things. You know, if it's really too much expensive, maybe we can change for a generic, you know, brand, not brand like medication, and we can change for different things.
And some drug companies will have programs for to help to patients that have trouble affording their drugs.
So we need to know.
But you need to know.
If you don't know, you can't really help patients. So that's important. Bring a list, and not only that, most of the patients are seeing different physicians like primary care and cardiologist and, you know, hematologist. So they all can give different medications, and if we're not in the same system, I will not know.
You know, I think that you've just touched on a very important point. With the electronic medical record, there has been a lot of talk, I think ideally at upper levels, that the information would be available to every doctor everywhere in the country. That is simply not the case.
Not the case.
And they're still very fragmented.
True.
And it's impossible to really get an absolutely accurate listing of doctors' medicines or problems.
Yes, so you need to be on top of that.
You need to control your own health.
You need control, it's your health, so you really need to be on top of that.
Throw some other things out. Past history, especially with a new physician, they want to know about past operations, past medicines you've been on.
Everything.
Get them ready ahead of time.
Yes.
Think about it. Pull out your records.
Or you'll be called for a next appointment, which is also not maybe good for you. Nobody has time. Like patients, they want to enjoy their life, not to follow up for something that can be done on the one like initial visit.
Do you want to say something about also if you do have a problem, how a patient can be a better historian, how they can be a better detective and help us figure out what's going on? Because frequently they'll say, well, I have a pain. Well, what kind of pain is it? I don't know. Where is it? Well, it's sort of here. And you know, those don't help us very much. Do you want to say a few words about that?
I mean, any kind of symptoms, especially if you have symptoms for like chronic for a couple of days, couple of months, couple of weeks or couple of months. Maybe, you know, making your own symptom diary so you can write down what kind of pain is that? How severe is that pain? What part of day you're having pain? Is it related to food or exercise?
Yeah, anything brings it on or precipitates it.
Yes. So I think it's important to just write it down and then bring those notes to your doctor.
Try to be as accurate as possible.
As accurate as focused.
Because we're taught to help diagnose disease based on pain, the quality of the pain. Well, pain is pain, most people. No, it isn't. There's dull pain, there's sharp pain, there's pain of a broken bone, there's pain of stomach cramps. It can be crampy or steady. Associated symptoms.
Do you have vomiting, nausea, or you have dizziness and palpitations and
so be an observer, be a detective with the doctor. Don't the more information.
It's a team work, definitely.
And that's so helpful.
We're on the same side, so.
And as you said, writing things down, because I do think people think, oh, I want to ask the doctor about that, but especially now with the phones where you can jot notes in any phone, there's no reason not to have your questions recorded so you make sure you ask those things that are important to you.
And it's really important.
Anything else that you like to ask patients to prepare for the doctor visit?
I mean, medication's important, any specialist that you're seeing, so we can obtain records and we can work together. That's also really important. And just deciding between what kind of visit you want to have that day. Is it going to be follow-up on the chronic issues, or you're having acute symptoms, or you want just a screening annual? It's like different questions.
So how does the patient do that? Do they talk with with the office manager or the person that
or
they
with
call?
us? They can always,
but they
send
say,
a message.
I'm having this new problem I need to discuss with the doctor.
Yes.
Because then you'll allocate different amounts of time based upon what you think.
That's yes. We need to know ahead why the patient is coming in. Is it only cough, or it's shortness of breath plus coughing for like 3 months and weight loss? Different things may be happening and we don't know. So we do have nurse in the office, so when patients are calling, we can do, they can talk with the nurse, they can talk with us and the front desk, and we can definitely make sure that they're getting what they need.
Now, you're a modern doctor, and the internet is part of modern society.
Yes.
You can look any symptom up you want up on the internet and get a lot of information and misinformation on that.
That's true, yes.
How do you suggest that patients handle that? Because I think as a patient you can be inundated by too much information, and some of it erroneous.
Yes.
How do they wade through that? It seems like I'd suggest you need your physician to help wade through that, but how do you manage that in practice?
I don't mind when patient is well informed. I really don't mind that. Just I think if they're too much spending some time researching the symptoms, they can be so anxious when they come, and it can be a big deal from really nothing. I think the safest is really talking to us.
Some other things I've told patients, the information available on the internet ranges from extraordinarily accurate to complete nonsense. And the way they can assure that they're getting accurate information would be to go to a well-known, established medical site like mayoclinic.org or one of those. I find that some of the chat rooms have the most misinformation as patients say, well, I've had I have the symptoms just like you, and my doctor found out it was this rare disease. And those things can be very, very deceiving.
Yes, and also we always give patients handouts, with some educational materials they can read on and, just, inform themselves. Because I think it's important.
Certainly can be informed. There's a lot of great information there, but just you can drive yourself nuts too.
Oh, definitely.
And you can find something that fits what you wanted to find.
You can always find in any kind of disease. Yes.
And I think that in certain ways makes our job. I think the informed patient makes our job easier, but some of the misinformation makes it harder.
Yes.
And unfortunately, we've run out of time. I think that's all very valuable information. I want to thank my guest, Dr. Jasmina Krstic, for joining me on Health Talk today, and thank you for watching. Remember to send your questions and comments to us by calling Community Relations at Nuvance Health, 203-852-2250. Thanks so much for watching.